Hi friends, I'm Diba, and today I'm going to show you how to assemble and use a supplemental nursing system. We also call it an SNS. Before using an SNS, I do encourage you to talk with your lactation consultant. There are a few reasons why you may use an SNS. The first reason would be if your baby is needing to get some supplementation, either of expressed milk or formula, whichever you are using. But this will allow the supplementation to happen at the breast, which not only helps the baby get their milk through both you and the supplementation, but also helps to increase your milk supply because your baby is staying at the breast longer and more active. Another reason you might need to use a supplemental nursing system is if you are adopting a baby and you would like to breastfeed or chest feed, and this way you can provide the milk that your baby needs while still having that bonding. And for those of you who might be relactating or inducing lactation, this keeping the baby at the breast, removing milk, will help to increase your milk supply. So now I'm going to show you how to put this together and how to use it. So this is a short-term SNS, and it is the more commonly used one, especially in the beginning days. With the short-term SNS, you're going to get all of these pieces. So you're going to put your supplement into the bottle. The next thing I like to do is take the wafer piece here, and you're going to put your membrane in there. And this membrane is really important. If there is a tear in it, it's not going to work well. So you want to make sure that your membrane is intact. And if you see, there's this concave part here and there's a flat piece here. So you're going to turn it to the concave part and put your membrane right in there. And if you see it on the back, you're going to push it through so this piece comes all the way out. You don't want it to be just halfway out. That's not going to work. So you want it all the way out. Okay? Next thing we'll do is now we're going to take this nipple piece, and on the tubing, this is a little clamp, and what you do is just put the tubing through there, and that stops the flow of the milk going through. So you want to do that first. Next, you'll put this wafer piece in that we've gotten together, and you're going to put it to where this button side is looking at you. So you'll put it right on in there, and you're going to press down, and it'll engage into the lid so that when you turn it over, it's not going to come out. Okay? Next, we're going to put the bottle on. Turn it upside down, and now we're going to fill the tubing, and this is called priming. And what we're going to do is just squeeze this teat here, and we want to get it halfway full of milk. And notice how I'm kind of doing it slowly so it doesn't fill too much. Okay? And I had to do it a couple times. Sometimes you'll get it on the first time and other times not. Now I'm going to unclamp my tubing and see how the milk is already starting to go down the tube. And you're going to wait until it gets to the very end, and then you'll clamp it again. All right, so now your SNS is ready for use. It also comes with this little rubber band and clip. So what you will do is put the rubber band here, and this part is going to clip to Mama's shirt. When you clip it to your shirt, it's best to do it on the opposite breast that you're going to be feeding from, so that you can tape the tubing to where just a little bit of the tubing, about 1/4 of an inch, extends past your nipple. And I like to tape it to where it's nice and close to the nipple, and then also put another piece of tape so that the baby can't grab the tubing down. So once the tubing is in place and you have taped it on, you can latch your baby to the breast and then unclamp the tubing so that the milk can flow as your baby eats. How you know that the milk is flowing is that you want to look for bubbles in the bottle. The other thing I like to do is to turn it upside down and let some air go into the tubing and then turn it back right the way it's supposed to be so that when the baby sucks, that air that you've put in the tubing will shoot through the tubing and you know that it's in the right place. You're going to want to clean it after every feeding. So whatever milk that's left over, just going to empty it out. Then I like to rinse it out first. And we need to get this tubing rinsed out. So we're going to do the same thing that we did initially. So we're going to run it through with some soapy water. So you're going to put your baby safe soap in there. I like to get it soapy by shaking it up. Okay. Then we'll turn it upside down, do that same thing where we prime. Get the soapy water in there. Now we're going to prime this tubing and clear out all the milk that was in there. Okay. I like to do that several times so I know it's nice and clear. So it's coming out nice and clear. Okay. Next thing we're going to do now is we're going to rinse all the soapy water out. And now we're going to put clean water through to rinse out that soap. So turning it back upside down. Now we're going to just put the clean water through. I like to try to make sure that this isn't going into the sink, so I like to hold on to it. Okay, so now we've gotten all the soapy water out. So all that step there was just to clean the tubing. Now we're going to clean everything just like you would your bottles or your pump parts. So we're going to take it all apart. So then we're going to add some warm water, some soap, you'll put all your pieces, whatever kind of bowl you use to wash your parts. Now we're just cleaning all this outside here. And then you rinse. And then you would set aside to air dry. Make sure your surface is nice and clean and sanitary that you're putting it on, and that you're putting it on something to dry, like a paper towel or a drying rack if you have that. I hope you enjoyed this video, and just know that we are here for you. We take insurance, so then that means that there's no out-of-pocket cost to you. We want to support you and help you in any way that we can. We do provide nationwide telemedicine services as well as local in-office services. We're doing everything to make sure that you have the support that you deserve and that you need when you need it.